In a new book called The Nurses, A Year of Secrets, Drama, and Miracles with the Heroes of the Hospital, writer Alexandra Robbins details the experiences of nurses all over the country. Now, there is one section of this book that actually absolutely fascinated me, caught my attention, and it was written in an article. In this part, she talks about how wealthy people are taken care of in these hospitals, normal hospitals all over the country, in contrast to regular people. Now, this is going to fascinate you. It might not even shock you, but trust me, it is kind of fascinating to read. Now, she basically starts out by talking about why politicians and people in the wealthy media elite continue to call the healthcare system in America the best in the world. Well, because from their context, it is. And I'm going to detail why. Now, in this book, and she says, a Virginia nurse explained to me why Washington might not understand healthcare. Politicians have such a warped sense of how the healthcare system works because they never actually have to be part of the actual system. Now, what does she mean by that? What did that nurse mean by that system? Not actually part of the actual system. Is she saying, is there a separate system for people who are wealthy or people who are politicians and VIPs? Well, yes, it turns out there is. Politicians and other VIPs can get special access to critical care. Hospitals across the Washington area, and indeed across the country, have exclusive rooms and sometimes even separate floors for treating the rich and famous. And I think I remember reading a report about Kim Kardashian having her own floor when she was having her baby in Northwest. So that's something that we have heard about in the news, and that I think a lot of people were understandably pissed off about. Now, one nurse in the book told Alexandra, sometimes we're told to treat certain patients better. Many hospitals treat VIPs better than the average patient, saving deluxe private rooms for the celebrities, politicians, and officials who know about them. While some luxury rooms are available to any patient who can pay, others are kept secret. So even if you had the money, but you're not especially rich or especially famous or a VIP or a politician, you can't even know about some of these secret rooms and even secret floors in these hospitals. A Washington, D.C. Hospital, for example, has a VIP unit devoted to patients such as visiting foreign dignitaries, senators, and professional football players. It doesn't have typical hospital furnishings. The rooms are much bigger, with fancy bedspreads, decorative pillows, and lavish curtains. And this is according to a Maryland nurse who used to work at this hospital. The patients are served excellent food, much better than the food on regular floors, and they're given anything they request. The nurses cater to their every whim, and it's a restricted floor with no access from the regular elevators. Most people don't even know that this floor exists. So here's an entirely different world inside of this hospital that caters only to the rich and powerful. Fascinating. Now, there's more. Across the country, nurses described VIP accommodations that look more like spacious luxury hotel suites than hospital rooms, with kitchenettes, glass-tilted bathrooms, and other amenities. In one Washington state hospital, when a VIP comes in, the staff combines two rooms to make a large one. They're instructed to bring in a large screen TV and the VIP furniture. After the VIP is discharged, a nurse said, the furniture is removed and stored until the next VIP admission. Quote, they do this for rich and influential people, and we nurses are disgusted by it. Nurses are taught to treat each patient as an important person and to give our best care to each one of those patients. Now, I go back to where these nurses are told, sometimes we're told to treat certain patients better. Well, that goes against the entire ethos of the medical field, where you're supposed to treat everyone equally. But we can tell here in America, according to this, that we do not treat everyone equally. There is a huge disparity in care. So it's no wonder that the politicians that you see on TV, the pundits that you see on TV that are most certainly wealthier people, have had no problems with our healthcare system. It's the best healthcare system in the world. We have the best doctors. We get the best care. What are these poor people complaining about? You can just go to the emergency room and get your lavish big screen TV while you're getting care free from the government. What? What's your problem? Why are you complaining? Why do you want universal health care? It's one of those things. It's a complete disconnect. And not only this, but having these special VIP rooms and having nurses, in their words, cater to people who are influential and wealthy, cater to their every whim, well, that kind of takes away from other people's care, the normal people, the plebs, the poor people, the middle class people, people that aren't wealthy. It takes away from their care. In fact, she writes in this book, VIP care becomes problematic when those patients unnecessarily take up resources that more critical patients need. Sometimes they will get a one-on-one nurse, or we're all told to give them extra special treatment. And this is according to a New Jersey nurse that is unnamed. I've seen critical patients who should be next to the nursing station moved so that a relation of the board member, a big donor or celebrity, could have the better room if their condition didn't warrant that level of observation. At another local hospital, they had an entire VIP section set aside. Those rooms were, quote, not to be used for the riffraff. The riffraff. That's you guys. That's us. We're the riffraff. We don't deserve special care. Okay, I'm gonna nerd out for a second here, but bear with me. There was an episode of Star Trek Voyager, okay, called Critical Care. It was where the doctor was transported to this place, this society that had a system set up where only people who were important got the highest level of care. Everybody else down at the bottom, well, they didn't get the resources. A person who was sick on that floor could have been treated by something that would save his life. There was a medicine that would have saved his life, but guess what? It was used to prevent arterial aging for the rich and wealthy people who were deemed more important by society. This is what our hospital system has turned into. It has turned into an episode of Star Trek. In the worst possible way. It is ridiculous. We are the riffraff. We're the ones who are unimportant when it comes to the hospital system. So once again, you can kind of understand why people who are wealthy and influential have such a rosy view of our healthcare system and don't think it deserves any sort of change. Oh, we don't need to change a thing. It's working great. Well, it's only working great for you and your limited point of view, and you and your bubble. But for the rest of us, it doesn't work. That's why we need to change the system. And it's also why we need to have a universal healthcare system. Now, even more, like, this is the last part of it, but it's a little, also as disturbing as everything else. If you think this didn't happen at every hospital, it does. From the book, every hospital which the Virginian nurses worked at, a couple of rooms, if not a floor dedicated to VIPs, which is often hidden, exists. At one hospital, there is a room specifically maintained only for the use of a very famous person with a very crappy heart. They'll get the best food, nicest room, the most accommodating physicians, and the nurses who are easiest to push over. So you want nurses that you can basically boss around. Classy. But when it comes down to resources, right? The hospital left the VIP section completely empty unless a VIP was present. And you could use that for other people as well, but no. We can't have the riffraff up there. VIP only. If you're riffraff and you need help, well, you're just going to have to wait in that clogged waiting room, even though we've got a VIP room freely available that we could use. I thought the medical oath was do no harm. Well, by making people wait and not get the resources that they need, you may not be implicitly doing harm. Or I should say you may not explicitly be doing harm, but you're implicitly doing harm by not doing anything at all. And that is just wrong.